Class is in session. As you can see, we've all gathered. We're back with Dr. Sanford Chen today, explaining to us how a simple eye exam could help diagnose several conditions before you even have some of those symptoms. Welcome. It's good to have you here. We've all gathered because we have a lot of questions. But first of all, annual eye exams, these are important or extremely important?
Well, yes, they're very, very important. Actually, the eye is a very, very special and privileged organ in that it has a very, very rich blood supply and excellent circulation. So sometimes if you look very, very deeply into someone's eyes, you may actually discover some clues about what's going on in the rest of your body.
Oh, wow.
Like what?
Yeah, like what?
Like what, doctor?
Well, let's go through some examples.
Okay.
And first, before we start, I actually would like to go over the normal retina so that you have something to compare to. So first of all, this is a picture of a normal retina, and I want to make sure that you guys pay attention to this sector right here. This is the optic nerve, and you notice how it's pink along the edges, and it has very sharp borders. That's very important to know. Secondly, these are your normal retinal arteries and veins.
Okay, from a normal eye, all right?
Right, this is another picture of a normal eye, but this is focusing a little bit different section known as the macula, and this is where all your fine focusing goes into play. So when you're reading,
is that what they call macular degeneration? Is that what
that's
happens?
actually the exact area that is affected in macular degeneration. Yes.
Okay. Is this some
eyeball is this?
I'm sorry?
The back.
This is
the retina. This is the very far back nerve layer that gathers all the light. It sends impulses to the optic nerve, which connects directly to the brain, which then interprets the images.
And just to be clear, is this what you would take a sample of in a normal eye exam, or is this something a little bit more advanced than what you would expect in a normal
This is pretty much in a normal comprehensive eye examination.
Okay.
There's sometimes when you go to the eye doctors, you don't get your eyes, quote, dilated, because people don't like to have these big pupils and the bright lights bother them. But in a comprehensive eye examination where you really want to look in the back and do a full exam, you will have to dilate your eyes, and then your pupils are just huge.
Okay.
And this is a very difficult picture to obtain without having that big window to look back into, because otherwise your pupils are small and it's like having a shade covering.
All right, so let's see some of the
next
some of the examples that you have.
Right. So here's an example of somebody who has hypertension, high blood pressure, and this is a lady that basically walked into my office and she said, "Oh, I'm having some headaches. I think I need new glasses and contacts because I think I'm having a little bit of eye strain." So we said, "Okay, fine. Let's dilate her." We take a look, and as you can see, once we looked in the back, completely not normal.
This is the back of the eye?
This is the back of the eye compared to what the other normal one looked like. So the first thing I want to just make note of some things. This little white spot, this is abnormal right here. And this is actually called a cotton wool spot. And the reason for that is when you look into the eyeball, it actually looks like a little soft, little puffy cotton ball. The other thing that you'll notice that's very unusual are these big yellow streaks. And these are right in the macula. And this is actually deposits of protein and fat that have leaked out of the blood vessel that have now deposited into the retina itself.
Oh, why does that happen?
And we call this a macular macular star. Basically, sometimes the pressure is just so high that it pushes it out.
From the high blood pressure?
From the high blood pressure, potentially, yes. But there are other reasons as well.
Now, do you send them to their doctor when you see that to say you should have your blood pressure checked?
So that's a great question. So what we did with her is as soon as I saw this, I go, boy, this is not normal. Something's happening. I had my technician come and get a blood pressure cuff. We put it on her. 225 over 150.
What?
That's really high.
Absolutely.
She had no idea.
She had no idea. Well, she had a little bit of a headache, but she thought she had eye strain and needed new reading glasses or some sort of glasses.
Wow.
So immediately we called the paramedics. They came in. We said they went straight to the emergency room.
Wow.
And we basically said, you are not leaving this office because you could keel over on the street with that kind of a blood pressure. So there was basically boom, boom, boom. And she was off to the emergency room.
Okay, what's next?
What do we have?
So that's one example. Here's another example of what we can see in someone with high blood pressure. This is known as a central retinal vein occlusion. And what happens is, remember that normal vein that I showed you again, that gets plugged up. And everything reverses and the blood vessels burst and the eye fills up with blood like this. And when we see this, we call this blood and thunder fundus. And you can actually see why. So when we see this, sometimes people come in and say, wow, I'm fine, I don't have any problems. So you better go get your blood pressure checked because this is really associated a lot with people who have high blood pressure.
Okay. So once you're on medication, does that change the way it looks?
Once you get on medication, well, yes, you can actually reduce some of the swelling. The blood actually gets resorbed, but it takes time, and sometimes it could take weeks to months for this to all go away.
All right.
What's the next?
So these are
condition?
examples of people with high blood pressure. So let's move on to diabetes. What do we see in people with diabetes?
Okay.
This is a very interesting case of a college student. He knew he had diabetes since he was about 8 or 10, but went off to college, was having a good time, and didn't monitor his blood sugars, was drinking, was eating, having the fun of his life because, hey, I'm in college, I'm enjoying life.
Yeah.
Came back for spring break, his mom says, let's get your eyes examined. Didn't have any symptoms, we dilated it up, and you can see these huge fronds of abnormal blood vessels growing off the optic nerve. And this could be very dangerous because these can bleed, or they can scar and lead to retinal detachment and complete blindness.
Do these, I'm sorry, I do feel like I'm in school.
Yeah.
Do these conditions, high blood pressure, diabetes, do they affect your eyesight?
Sometimes they do, sometimes they don't. Like I said, with the first patient, she came in, she had a little bit of a headache, but she wasn't really complaining of any visual problems. This person, again, because it's not affecting the macula, probably is not having any symptoms. He was just going about doing his schoolwork. Occasionally, if it gets advanced, and I'll show you some things here, where you'll know that they actually will have some blood, they'll notice some vision problems.
So if I didn't know I had diabetes and you saw me, would you send me to a doctor to say you should be tested?
Absolutely.
This is a precursor, or I'm not a precursor.
This is pretty advanced. This is somebody who's had diabetes for a long time, and like I said, this boy is in college now, but he started in elementary school at 8 to 10 years old.
Right.
Okay.
So that's a great question, because that leads me to this picture right here. So this patient walks in, fine again, not a problem. And we dilated her, and we saw a couple of these, hemorrhages here. Again, some of these lipid deposits, but she was completely asymptomatic, didn't have any problems. We looked back then and we said, this is a little suspicious. You can tell this vein's a little bit thicker as well than the normal. And we said, hey, you probably ought to go to see your primary doctor and see if there's anything going on. So we sent her to her primary doctor. They did a full workup. And they discovered, wow, your blood sugar is a little bit high, you have diabetes and we have to treat it. Now suppose that she didn't come in and went 5 years, didn't see me, and we didn't know anything. This may have been what happened. Because that left untreated could lead to something like this.
What is that? Do you go blind?
Well, you have to do a lot of work to try to save this eye. Nowadays, with all the technology that we have, this patient probably would not go blind, but probably wouldn't have great vision like you and me.
Wow.
My, okay.
What's next?
Leukemia and anemia. This is something we've actually discovered by looking in the back of the eye as well. And these people are walking around fine, just like you and me. So here's an example again of somebody that had dilated eye exam. We took a look and we found these, again, hemorrhages, red spots. But if you note real closely, these are a little bit different than the other hemorrhages. If you look close, got little white centers in them. So these are known as white-centered hemorrhages. And when we see these as compared to other ones, we think of a whole different list of problems. So this we might see in someone with anemia, leukemia, certain collagen vascular diseases that are related to arthritis. So there's a whole new different thing that you think of with these type of hemorrhages as opposed to the hemorrhages that you see in high blood pressure and diabetes and things like that. So even with hemorrhages in the back of the eye, you think of different things.
Wow. And next?
The next one is?
Papilledem.
What is that?
This is a fancy word for optic nerve head swelling. So remember how I told you I wanted you to pay attention to the optic nerve?
Yes.
Here's an example of somebody with nerve head swelling. And you can tell now the whole thing is much brighter red than sort of the pinky vision. The edges are very, very fluffy here. It's not a real sharp border. It just looks like it's swollen and coming out at you. And also, if you look real closely, you can see these stress lines over along the side here from the optic nerve actually pushing out. So this is actually something that's very interesting. When we see this, we can think of certain things as well. Some with multiple sclerosis may come in as the first sign of multiple sclerosis, having a swollen nerve. But the most worrisome thing we worry about this is high pressure inside of the head. And that can be caused by different entities as well. And first thing you think of, and obviously the one that's the most scary, is a brain tumor.
Of course.
So if you have a brain tumor that's pushing and your pressure in your head is going high, it can get reflected into your nerve like this.
So there's one last one that you had we want to get to before we...
Yes, and the last one, this is a sad case, metastatic cancers. These two can present for the very first time by looking in someone's eye. This is a poor woman that yellow deposits that are very deep to the retina, and they're actually a little bit elevated and raised. So when you look there, it looks like a little bump. And we saw that, and obviously some alarm bells went off in my head, and I said, boy, you better go see your primary doctor again. We sent her off, and I already knew, so I said, listen, look around. Maybe she's got some cancer somewhere. You really have to be careful because this really rang, alarm bells. So they did a full workup. She had a mammogram, was discovered to have advanced breast cancer.
My goodness.
Wow.
Didn't even know.
All by looking.
All by looking in the back of the eye.
And then you would say to have an annual exam is important for your eyes?
Absolutely.
To keep on top of
yes,
everything?
and certain people, especially if you have a health history.
Okay.
Wow.